Hey, this is Butheau Physio, and today I'd like to talk about arthritis and more specifically arthritis in the hip joint. So, things that you can know or do or evaluate to kind of tell you if you potentially have some arthritis and some stuff you can do at home. So, I want to make clear that obviously that diagnosis a physician would be doing this and to rule in what a potentially a physical therapist might have found or another health practitioner. But we need a obviously imaging and an X-ray to rule that in. But for the most part, with arthritis, you will feel a lot of increased stiffness and soreness with sitting for a long time, as well as getting up in the morning. You will feel some pain as well, potentially in from the knee into your hip, as well as progressing into your upper back as well. And another thing that you should take a look at is your motion. So your motion, we talked about internal rotation this past week, and this would be internal rotation. So if you are liking more and more of this motion, it can be a sign that your hip is becoming arthritic, and that was my point with those exercises I showed you this week on how to maintain the mobility in your hip. So in order to prevent some arthritis or the effect of arthritis. So in my case, you can see I have to work more on my left hip than my right because I have less motion here. The other, also going the opposite way could be a sign actually of arthritis. Not being able to cross your leg, or especially if you try to cross your leg like this and you're unable to bring that foot up there. And for internal rotation, the same way, if you were to pick up your leg and can as soon as you pick up your leg, your foot goes in. That means you certainly don't have enough of that motion to counteract, and it just goes straight. People that lift their leg can only lift their leg like this. That's kind of very typical of arthritis. I see this quite a few times. And one thing that I want to make sure is that when you also have knee pain, and even if you don't have a hip pain, you should have your hip checked. I have had many patients that came to me because of knee pain and were assessed and had x-rays and other imaging done to their knee showing some arthritis. But truly the pain that they felt in their knee was actually referred from their hip, and that is very common, especially pain, medial knee pain, so what we call the inside of your knee here. If you start having pain, it's pretty localized to that area, that can actually be a sign of hip arthritis. So always insist on having your hip looked at as well, because sometimes that can be the source of your pain. I've had some patient undergoing knee replacement and still having pain afterwards, and their pain subsided once we started working on their hip, and especially internal rotation mobility. And one thing that might sound a little really common sense would be to just move and walk. A lot of people, when they start having arthritis, it's counterintuitively, they think they should stop weight bearing and stop walking, and actually that makes their problem worse, because your joint still needs all that movement, and walking is one of the best thing to maintain hip mobility. And so please, even if you have hip arthritis, continue walking. There's obviously, you might need help from a physical therapist in order to do the proper warm-up, the proper stretches, proper mobility exercises, as well as strengthening, in order to be able to walk without irritating your hip. But walking is an essential part in treating hip osteoarthritis, so don't forget that. All right, I will catch you later with more info on the hip, and have a great evening. Bye-bye.